Welcome to the channel. In this lecture, we'll be discussing the anatomy of the breast. By introduction, the breast is a modified sweat gland that lies in the superficial fascia of the pectoral region. It is also known as the mammary gland. It is present in both males and females. However, it is rudimentary in males and becomes well-developed in females at puberty. In uncommon situations, the male breast may become enlarged. This condition is known as gynecomastia. It serves two main purposes in females. First, it functions as an accessory sex organ of the female reproductive system. Second, it produces and secretes milk for the nourishment of the newborn. Anatomically, where is the breast located? The breast is located in the superficial fascia of the pectoral region. A small part of it, known as the axillary tail of Spence, extends from its superolateral part, pierces the deep fascia, and enters the axilla. The aperture in the deep fascia through which the axillary tail passes into the axilla is called the foramen of Langer. The axillary tail is a common site for the development of breast tumors. In terms of its shape and extent, the breast is a hemispherical bulge situated on the anterior thoracic wall. Vertically, it spans from the second rib to the sixth rib, and horizontally, it extends from the lateral border of the sternum to the mid-axillary line. Now, let's examine the relations of the breast. Deep to the breast lies a precisely organized sequence of structures, arranged with remarkable anatomical order. Immediately beneath the breast is the pectoral fascia, a strong, glistening layer of deep fascia that wraps over the pectoralis major muscle like protective anatomical armor. Beneath this fascia, the breast rests upon three key muscles: the broad pectoralis major, the serratus anterior sweeping across the ribs, and the upper fibers of the external oblique muscle. Between the breast and the pectoral fascia lies the retromammary space, a layer of loose areolar tissue. This natural glide plane acts like a soft cushion, allowing the breast to move freely, upward, downward, and side to side, over the chest wall. Structurally, the breast is composed of three beautifully coordinated components: the skin, the stroma, and the parenchyma, each with its distinct structure and essential function. The outermost layer of the breast is the skin, and it bears two important landmark features that define both the appearance and function of the breast. Let's take a quick look at the external features. The nipple is a conical projection located just below the center of the breast, usually lying at the level of the fourth intercostal space. It contains smooth muscle fibers, which allow it to stiffen, flatten, or become erect. Richly supplied with sensory nerve endings, the nipple is the most sensitive part of the breast to touch and becomes prominently erect during sexual arousal. Surrounding the nipple is the areola, a circular pigmented zone packed with modified sebaceous glands, especially along its outer margin. These glands secrete an oily substance that lubricates the nipple and areola, helping to prevent cracking and dryness. Next, we'll explore the internal structure of the breast. Deep to the skin lies the stroma, the supportive framework of the breast, composed of connective tissue and fat. This layer provides the breast with its shape, firmness, and structural support. The fat forms the bulk of the breast and largely determines its size and contour. It is distributed throughout the breast, except directly beneath the nipple and areola. Within the stroma, portions of connective tissue condense into fibrous bands called the suspensory ligaments of Cooper. Arranged radially, these ligaments anchor the dermis to the ducts and to the pectoral fascia beneath. They play a crucial role in maintaining the natural lift and contour of the breast. With aging and gradual atrophy of these ligaments, the breast becomes increasingly pendulous. At the core of the breast lies its functional tissue, the parenchyma. This glandular component is responsible for milk production for the nourishment of the newborn. The parenchyma consists of 15 to 20 lobes, arranged radially like the spokes of a wheel, all converging toward the nipple. Each lobe is subdivided into lobules, which contain clusters of acini, the true milk-secreting units. Each lobe drains into a lactiferous duct. These ducts course toward the nipple and widen near their termination to form lactiferous sinuses, which act as small reservoirs where milk collects during lactation before being released at the nipple. Arterial supply. The breast is one of the most richly vascularized structures in the body, receiving blood from multiple arterial sources that approach it from all directions. First, the internal thoracic artery, also known as the internal mammary artery, contributes through its perforating branches. These branches pierce the second, third, and fourth intercostal spaces, supplying the medial portion of the breast. Second, the axillary artery provides the major arterial supply to the lateral breast. Its important branches include the lateral thoracic artery, the superior thoracic artery, and the acromiothoracic artery. Finally, the posterior intercostal arteries contribute lateral branches that provide additional blood supply from behind. Together, these arterial networks form a robust, interconnected circulation, essential for lactation, tissue healing, and the metabolic activity of the mammary gland. Just as the breast has a rich arterial supply, it also has an extensive venous network that drains toward three major veins. It occurs through superficial and deep systems. The superficial veins drain the skin, nipple, and areola, forming a subcutaneous venous plexus. The deep veins drain the glandular tissue and generally follow the arteries, draining laterally into the axillary vein, medially into the internal thoracic vein, and posteriorly via the posterior intercostal veins into the azygos, in the right, or hemiazygos, left system. Lymphatic drainage of the breast is clinically very important, as breast cancer is common and malignant cells frequently spread along these pathways. The majority of lymph drains to the axillary lymph nodes, which are organized into the anterior, posterior, lateral, central, and apical groups. Additional lymphatic drainage occurs to the internal mammary, or peristernal, lymph nodes along the internal thoracic vessels, and to the apical, infraclavicular, and supraclavicular lymph nodes. Smaller amounts of lymph may also drain to intramammary nodes and to the delta pectoral, or cephalic lymph nodes in the delta pectoral groove. Nerve supply of the breast. The breast receives its nerve supply primarily from the second to the sixth intercostal nerves through their anterior and lateral cutaneous branches. These nerves provide somatosensory innervation to the skin of the breast and also carry autonomic fibers to the smooth muscle fibers of the nipple and to the blood vessels. Let's take a quick look at some important clinical correlations of breast anatomy. Breast cancer is a significant health concern, but early detection saves lives. Mammography and regular self-examination are key tools for identifying abnormalities. During a breast examination, start with inspection. Look for nipple discharge, which may be colorless, milky, or bloody. Observe the skin for puckering, dimpling, or color changes, and check the contour and symmetry of the breasts. Next, use gentle palpation to feel for any lumps or areas of firmness. Take note of any tenderness and pay attention to any pain or discomfort experienced. Developmental anomalies may include polythelia, or extra nipples along the milk line, polymastia, or extra breast tissues along milk line, inverted or retracted nipples, and in males, gynecomastia. Regular awareness of these signs, both during self-exams and clinical assessments, supports early detection and a better understanding of normal and abnormal breast anatomy. Thank you for watching. If you found this lecture helpful, don't forget to like, comment, share, and subscribe for more clinical tutorials.